Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about a very common problem or a common operation which has been done called knee replacement surgery. What is knee replacement surgery? Knee replacement surgery is an operation. What kind of an operation is it? It is an open operation. That means you open up the knee joint and do your work. What do you do? The knee is a joint made up of three bones: the thigh bone, the leg bone, and the kneecap. All three bones are covered by cartilage, which is a polish so that there is smooth movement between the bones. As this cartilage starts getting rubbed off, bones touch against bone and there's friction. When there's friction, there is stiffness, because it's like driving a car on a pothole-filled road. So when there are deficiencies or loss of cartilage, the bones don't move smoothly, leading to stiffness. As a consequence, there's friction. When there's friction, little particles of cartilage go out, which irritate the covering of the knee called the synovium, which produces excessive lubrication. Much like tears in the eyes, there are tears in your eyes, but when you go to a dusty area, you produce more tears, but those tears can flow out. The tears in the knee, which is the normal lubricant in the knee, much like the lubricant in the eyes, which are the tears, they can't go out, so they lead to swelling and then eventually pain. So what's the solution? Sometimes you just treat it conservatively, but when you've thought of going for an operation, what you intend to do is give a substitute for that cartilage that has worn out or gone. So this is much like paint in the wall. So when paint goes away, if it's in a small area, you may do a touch-up work there. If it's in a larger area, you'd get a painter to change the paint overall. The painter takes a sandpaper, he rubs the wall and then paints over it. In this, unfortunately, God sends you on earth with only one bucket of paint and says live with it. However, man has a substitute, which is wallpaper. So what we do is we take wallpaper and put it on the knee. Not wallpaper in the true sense, but a cap. This cap is made up of cobalt chrome, which is an alloy which is anti-allergic and very long lasting and highly polished. This is put onto the thigh bone, the leg bone, and the shock absorber which finishes in an osteoarthritic knee is replaced with a plastic in between called a poly. You do the same on the kneecap. You put a small plastic button over it if you're replacing the patella. So in the true sense, this is not a replacement. This is a resurfacing. It's like putting the sun mica on a table or putting a wallpaper on the wall. You're not breaking the wall, you're not breaking the table. So the bone is not cut off and a new bone is not put in. You basically substitute the cartilage with a cap that is polished. As a consequence, you also straighten the knee so that the body weight goes in the center of the knee and there's no overloading on one side. Now, who's the ideal candidate? The ideal candidate is someone that suffers from osteoarthritis, has pain, and it's affecting his quality of life. When that's the case, you're the right candidate. Ideally speaking, this is done after the age of 55 when you do a full knee replacement or a total knee arthroplasty. But here comes the interesting part. A knee replacement may not be the whole knee. It could be the whole or part of the knee. So as I described to you, if there's a small area on the wall where the paint has come off, can't you just do a touch-up work there? Absolutely. So cartilage can go off from the whole knee or one part of the knee. Many times it goes off only from one part of the knee, especially when there's a malalignment. If ligaments are good and it's only that, then you need not do a full knee replacement. You could do something called a partial knee. That is just the area where the cartilage is gone. You put a cap and your job is done. I'm a firm believer that what God gives you is the best, what man gives you is second best. So preserve what he has without beating a dead horse and get your results done. So a partial knee may be on the inner side, the outer side of the kneecap alone. However, if more than 2/3 of the knee is damaged, then you need this, which is something called a total knee arthroplasty or a total knee replacement, which is or a total knee replacement. So normal indications are osteoarthritis, which is an aging process, rheumatoid arthritis, which is an autoimmune problem where the body starts fighting against itself. Osteoarthritis could be primary, that is happening on its own because of old age, or it could be secondary because of certain injuries on the knee, etc., in the cartilage, which have led to the cartilage degenerating faster. So nowadays you have two types, which is the conventional and the robotic. There's no obvious advantage of any of one over the other. Most of it is all marketing to say that the robotic is better than this, but we all go by science, which is publications. Longevity wise, recovery wise, they are both absolutely the same. Robotics is still in its incipient stages. It has a great role, especially in abdominal surgeries where there are a lot of vital organs, and as surgeons get older, their hands shake. So robots go exactly where they want to go. The knee is a superficial joint. The robot helps to some extent in alignment, getting better alignment, etc. But long-term results have been the same. Vis-a-vis recovery, what is it typically? You stay in the hospital, you either get one knee done or both knees together. Many times it's a symmetrical problem. I tend to do both together if the patient is fit and has all parameters mentally as well as physically okay for it. If one knee is done, hospital stays about a day or two. Both knees together, 3 to 4 days. You get up in one knee, same day. You walk with a walker or a stick. Both knees, get up the next day. By the time you leave the hospital, in both, you're walking independently with a walker. You can go to the bathroom, you're able to bend your knee, and you're able to eat sitting. Once that's done, you need physiotherapy also. So there's a physio that comes home. Their job is mainly to strengthen your thigh muscles and your hip muscles and make you walk correctly. Because remember, before a knee replacement, your knees were bowed. Your body was overcompensating, your gait, the way you walk had changed. So changing this is, once you change the alignment, once the knee is now all right, all these muscles have to recondition themselves to work with a normal knee. That requires training, which is what a physiotherapist does. You're more or less independent without any supports in 2 weeks after a single knee, and both knees after about 3 weeks. Stair climbing starts between 2 and 3 weeks when both knees are done. Single knee is done after a couple of days, one step at a time can be done. Physiotherapy is for about 2 months or so, initially regularly, then off and on, a couple of times a week, to be sure that you're doing it right. Physiotherapists are your tuition teachers. They tell you whether you're doing things correctly and make amends or change wherever things need to be changed, and take you from one level to the other. When can you start climbing stairs? When can you get rid of the walker? This I'm talking about from the law of averages. You can travel typically after 3-4 weeks by flight, etc. And you're more or less fine to go on a holiday after 6 weeks. There have been a lot of developments vis-a-vis making the surgery painless. And the way I do it, I did India's first daycare knee replacement surgery. Operated on the gentleman in the morning, sent him home by evening. People were shocked because of the lack of grey hair. And how did I do that? I said, it's basically the marriage of the mind and the body. Number one, the patient has to be mentally strong. Feel like I want to get out of this tunnel that I'm stuck in and feel I want to be better. Only then can you be better. Then comes the operation being done the way I do it. Minimal blood loss. I do not use a tourniquet, which is a device to cut off the blood supply in the knee when the surgery is being done, because of which the thigh muscles don't get insulted in any way and they are able to fire immediately after the operation. The kind of anesthesia given, we give local blocks. There's something called epidural anesthesia given when both knees together are done. This makes the knees numb after the operation. Remember, pain is produced by nerves called sensory nerves. There are two types of nerves, motor and sensory. Motor that help with movement, sensory that give you sensation. So in this epidural and blocks, we basically block the sensory nerves so that pain is minimized. The patient can mobilize quickly. Eventually the painkillers set in. By then, these are not necessary anymore. So all these things working in a seamless fashion give you a motivated patient and they're able to perform to the maximum ability and have the fastest recovery. I hope you got some information about knee replacement surgery. I hope you've understood that it's a very, very successful operation and great in the right patients. If you like my videos, please like and subscribe to my channel And please follow me on Instagram. Thank you.